Today, we're talking about angioedema caused by a certain class of medications called ACE inhibitors. Okay, let me explain. Angioedema, I'll discuss this more, but it's swelling, okay? And the class of medications that I'm going to discuss today that can cause this in particular is a class called ACE inhibitors, angiotensin converting enzyme inhibitors. These are very common medications, ones like LISINOPRIL, ramipril, etc. Why am I talking about these ACE inhibitors in particular as they cause angioedema? Well, first of all, they're not the only class of medications that can cause angioedema. However, this class of medications are and is the leading cause of drug-induced angioedema in the United States. Why? Because they're so widely prescribed. You might be on ramipril or lisinopril, etc. We are prescribed those medications because of blood pressure, heart failure, so many other things. But this class of medications can cause angioedema, what is it? It can be swelling of the lips, the tongue, the face, although you can actually get swelling in your abdomen and other places as well. I have another video on ACE inhibitors and some of the other side effects like a cough, etc. Now, you may be saying, well, if this can happen with this medication, why would my doctor put me on it? Well, first of all, let's back up, okay? Any medication that we have, every medication can have potential side effects. Do not let that get you hot and bothered, okay? Now, sometimes we do choose another class of medications over ACE inhibitors, angiotensin receptor blockers, but sometimes an ACE inhibitor might be needed, and we have to sort of mitigate and sort of think about this potential risk. Do not let this video make you think that you shouldn't be on an ACE inhibitor. That's not what I'm saying. What I'm saying is this is the potential reaction that can happen in some people who take this class of medications that I do think is very important to talk about. One of the reasons why I think it's important to talk about is because this reaction, angioedema, in people with ACE inhibitors, is 5 times more likely to happen in people of African descent. In fact, the only patients I have had that have gotten angioedema are Black patients. Now, it can happen in any patient. I'm just saying it's more likely in people of African descent. I'm not quite sure if we know why. There are other risk factors to getting angioedema, okay, not just genetics, not just being on an ACE inhibitor. There's other things, okay? But now let's talk more about what's going on here. Now, this is the thing. Even though the risk to any person of getting angioedema on an ACE inhibitor is relatively low, there's just a lot of people who are taking ACE inhibitors, right? And as I mentioned, it is the leading cause of drug-induced angioedema in the United States. Where in the body? As I mentioned, the lips, they get really puffy, really enlarged. The tongue, the face, upper airway. If it's really severe, somebody's airway may need to be protected, okay? The intestine actually can swell and get edematous as well. There can be abdominal pain, diarrhea, other gastrointestinal symptoms as well. So that's really important to know. And the photos I have here, I apologize in that I wish I had a more diverse range of photos. I'm telling you that it's 5 times more likely in Black patients, but I don't have very many pictures. I wasn't able to find any that I was able to use. So please Google after you take a look at this video angioedema photos so that you could really see the different range of symptoms that can present in people, okay? But generally, when the swelling comes on, it develops over minutes to hours, kind of comes on, and then it resolves over 24 to 72 hours, but complete resolution of the swelling, again, that typically happens or often happens in the face, can take days, okay? Angioedema does not occur in everyone who takes an ACE inhibitor. In more than 1/2 of cases, angioedema occurs during the first week of the exposure that the person has to the medication, but it can actually occur any time during the duration of a course of therapy, even from hours to years after treatment. What that means is I have had patients who have been on lisinopril for 20 years before they get angioedema. This is what I mean by it tends to be unpredictable, okay? And this is the thing, of course, if that happens to a patient, they get angioedema and we suspect it's the ACE inhibitor, we got to stop it immediately, no more. But the thing about it is that people can still even get some angioedema even after stopping that ACE inhibitor, okay? So there's a lot of education that needs to go into this if this is you. By the way, I'd love any of you who are watching to weigh in if you've had angioedema due to an ACE inhibitor. Also, if you've had angioedema due to something else. Now, what's going on here? It has to do with a substance called bradykinin. That's a vasoactive peptide where there's elevated levels of this bradykinin, which leads to vasodilation of blood vessels and a whole cascade of sciencey stuff that happens in your body and can lead to this angioedema. if somebody has angioedema due to an ACE inhibitor and the ACE inhibitor medication is not stopped, there is an increased and unpredictable rate of angioedema recurrence, meaning it can come back unpredictably and the attacks may become more severe or life-threatening, okay? Once again, as I said this before, if you have had angioedema due to an ACE inhibitor, the guidance is that you should never be treated again with this group of medications, this class of medications. There are plenty of other medications that we can use, okay? There are similar medications, there's not similar medications. And again, this video is not to make you say, oh my gosh, my doctor has me on this. Why would he put me on this? No, 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 no. Remember, any medication can have side effects, and they do. You take too much Tylenol. Now, this is not a situation of taking too much, okay? Because it's not necessarily a dose thing, okay? People on low doses of ACE inhibitors can get this. But with some medications like Tylenol, if you take too much, you can get liver problems. Some medications, like everything has a potential side effect. I would also argue getting in a car has a potential risk to it, right? So we're always weighing these risks versus benefits. So do not stop a medication based on this video, or do not change your mind about it. You simply want to ask about it. You want to inquire about it. You want to understand it. And if this is you, that this has happened to you, I would love for you to weigh in below about what your experiences have been. You know, angioedema is something that's very serious. If you ever experience this or anyone does around you, this is a hospital. This is a go to the hospital ASAP type of thing, because it can be very, very potentially dangerous. So I need you to understand that. So this is just a little beginning information about angioedema as it is due to ACE inhibitor medications. I do have a video on like LISINOPRIL, ACE inhibitor-induced cough. Take a look at that. If you don't see the video linked here, just DM me. I'll send it to you. But that is something that can happen with ACE inhibitors. Again, don't be afraid of this stuff. This is for your education and stuff that we always have to be on the lookout for as doctors. Remember to take your doctor's advice, get your doctor's guidance on any questions that you have. Let me know what you think. Let me know if this was helpful. And after this video, go Google some photos about angioedema so you can see more of how it can look. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on all sorts of things. Please like and follow my page on Facebook, on YouTube here. Please subscribe to my channel. Click the little bell for updates. Also, I'm on TikTok and WhatsApp and Instagram, etc. Please follow me there at Dr. Jen Caudle. And please go to my website to sign up for my free health newsletter at www.drjencaudle.com. Guys, I'm Dr. Jen. I'll see you soon.